going to be left alone. Then during awake proning, this picture is an example shared with one of the authors from France. And you can see that it's an open ward. And if patients was in the open wards, afterwards, we have heard a lot about that they remember and have heard things about what happened to the other patients. So our recommendations was to try to not speak too much and to decrease the anxiety for the patients. And during the time in prone position, they have to be informed about what happened because it's a long time to lay in this position. In low-income countries, there can be limited resources of oxygen. And if the patients have non-invasive ventilation or face mask for oxygenation, the skin have to be protected for ulcer because it was very common to get. About oral intake, when patients are in prone position, it's not recommended to oral intake. But when in supine position, sometimes the patients could have some oral intake. You have to discuss for every patient. We also recommend for the patients that if they are strong enough to use a phone or some digital devices, they should be allowed to do that. They could have connection with the relatives outside, and this could make them more relaxed. And if it's possible, it was not in the first wave, but maybe later or in some countries, the relatives could be by the patient's bed. When the patient is in prone position, the patient faces the armpit of the raised arm of which the elbow is flexed at 90 degrees, and the contralateral arm remains aligned with the body. A maximum closed packed position of the shoulder is avoided by keeping the shoulder of the raised arm at 80 degrees adduction or even lower. This picture shows that. Then we have a discussion about the pregnant women. The group suggested awake proning should not be withheld in pregnant patients, but supplemental oxygen should be provided such that pulse oximetry remains over 92%. To prevent aortic valve compression in pregnant patients, additional measures can be taken by organizing extra pillows and monitoring. In resource-restricted settings, the turning could be a rescue maneuver. Equipment needs to be adapted, could be folded blankets if they don't have pillows. And and it's also important to have some kind of monitoring. And if they have less or too little limited resources for that, they should have monitoring the respiratory, breath and saturation. And it's also important to have that equipment they have near the patient so they could use maybe the suction pump or something to some equipment when they have to intubate the patient.
So as a conclusion, we as a group concluded that awake proning is a safe and attractive adjunctive treatment in COVID-19 patients. It improves oxygenation within minutes and reduces dyspnea. However, we did not find any randomized evidence for the prevention of intubation. And if you want to apply awake proning on a ward or on the ICU, there are 5 practical aspects you have to take into consideration. And please train your team so they know what to expect and how to inform the patient. And all the detailed recommendations and things we wrote down are published in the American Journal of Tropical Medicine and Hygiene. So what did we gain from this project? I think what Eva and I think all the authors experienced, this was a very fast and efficient method to work together. We started with the project in about April 2020, and in the end of the year 2020, it was published. And it was so inspiring to work together online and work together in one document. And in the beginning, I couldn't believe that people were really going to find time for that and to really do it. And I was looking at the screen in the Google Docs document, and then I saw all these names going down and writing their text, and that was so inspiring to do together. And Eva?
Yes, the discussion in the groups were very interesting, and we learned a lot from each other. And we also see after we have published, and even before they who know that we are doing this project, that they want the guidelines. And I know that Wilmke get a lot of mails about when are the guidelines coming.
Yes. Yes, people were training, colleagues of mine were training people in Curacao and in Gaza and other countries of the world, and they were really waiting for when is it coming, is it ready? So it was implemented extremely fast. So I'm glad we could bring this to the people to work with it. So these were all the people that participated with us. The green ones are the ICU nurses, and the dark blue are the physicians, and the orange are the physiotherapists. And we all thank everybody for their participation, and thank you for listening. And if you have any questions, please feel free to contact us, or and maybe we see you later in the chat with Wouter. Thank you for your attention.
Thank you.
And there is Wouter again.
Yes.
Thank you, Willemeke and Eva, for your excellent presentation. I applaud on behalf of the audience.
Thank you.
Yeah, for me, it still looks strange, no? Someone just nearly totally relaxing, reading a book with a pillow under your chest, being awake in the intensive care. But working in Curacao in April, we did it as well. I don't know if that was based on your new guidelines or advices, but yeah, I've seen some really interesting outcome of it. One of the questions is, of course, what are your ideas about, let's say, the more mental support of patients? Because, of course, it's depending on how mentally fit or how sick they are when it comes to their oxygen level when we turn them on their belly in prone position. But of course, they are fully awake in that intensive care area. What is your experience with that?
Should I start with? Okay. My experience is that if you inform the patient before turning, so they know what's going to happen, and you have a team who is trained, so they know exactly what to do, and they do it safe, and the patient have some comfort when they are doing it. The patient mostly, after they have been turned, have a little bit easier to breathe, and then they get relaxed, but not all of them.
No.
The best is to have some staff who are just by the patient's bed after they have been turned. Maybe the relatives should be there, or the other family members.
No. It's interesting because one of the comments now in the chat is that that the proning can also be done at home for those who are breathless due to COVID infection. And in this case, you were talking about relatives. So it's good to train the relatives, not only to help them turning, but also to keep them company and to make them feel safe.
Yes.
Last question, also coming out of the audience. Do you know what is done with your advices? Because of course you say there's no evidence that it significantly protects patients to get intubated at the end. But is there done something with the advices when it comes to the guidelines?
Well, I know it is more advised now in other guidelines as well. And I know that there are being trials organized to see whether awake proning can prevent a possible intubation as well. So I think we just have to be a little patient, and maybe the next time we meet each other with FNOW, we can tell you more about that.
Okay. All right. Thank you. Well, I see that Joost is also proning himself to get in sleep when he's breathless, but I assume that you should do some little bit more sport. Yeah, Joost, then you're not breathless at the end of the day. Okay. Thank you, Wilmke and Eva. I would like
You're
to see
welcome.
you in the panel discussion. Thank you very, very, very much.